Transform your home during Blinds.com's Cyber Monday Super Sale. Get up to 50% off site-wide, plus huge doorbuster deals on popular styles. Go DIY and do it all 100% online, or choose white glove service with expert design help and professional installation. Both backed by Blinds.com's 100% satisfaction guarantee. Blinds.com's Cyber Monday Super Sale is here. Save up to 50% site-wide and get a free professional measure. Limited time offer, rules and restrictions apply. See Blinds.com for details.
I am so excited for this spa day. Candles lit, music on, hot tub warm and ready. And then my chronic hives come back. Again, in the middle of my spa day. What a wet blanket. Looks like another spell of itchy red skin. If you have chronic spontaneous urticaria, or CSU, there is a different treatment option. Hives during my next spa day? Not if I can help it. Learn more at treatmyhives.com.
This episode is brought to you by Progressive Insurance. Fiscally responsible, financial geniuses, monetary magicians. These are things people say about drivers who switch their car insurance to Progressive and save hundreds. Visit Progressive.com to see if you could save. Progressive Casualty Insurance Company and Affiliates. Potential savings will vary, not available in all states or situations.
So it's almost ingrained in us in going into motherhood, like everything's about the baby. And so it almost feels wrong to take care of ourselves. But I mean, I'm a big advocate, you can't pour out of the empty cup. And so you have to think about it from a proactive standpoint of, in order to be able to be the best mom and have the energy and be able to do the things without worrying about leaking and pain stopping you, taking that time to take care of yourself is been helping you and your baby and your kids and your family. And so I think that sometimes that perspective really helps moms see, like, you know what, I am worthy of it. Even outside of those things, just myself, I'm worthy to feel good in my own body.
I'm Jessica Vallant. I'm a physical therapist, women's health expert, and Pilates teacher, and my goal is to help all women feel strong, safe, and secure in their bodies. In this podcast, I'll share expert advice, facts, amazing guests, stories, compassion, and hope to help you meet your body in all seasons of life. The conversation I am bringing you today is one that I wish I had or listened to 13 years ago now when I was pregnant with our first baby. So even being a physical therapist for as long as I had been, when I got pregnant, I didn't fully understand the changes my body was going to go through during pregnancy and after birth, and the specific needs that I would have during that time when it came to physical fitness, physical needs, pelvic floor, exercise, all of it. Because of that, I am determined to bring this information to you all now. And this expert that I have for you today is all of it. I first found Lashonda on Instagram, actually, as it brings me so many amazing colleagues and people doing such great work. And right away, I knew that I wanted to bring her to you. This conversation is full of practical information. Even if you're like me, if you are past childbearing age, if you're not having any more babies, or if you had babies years and years and years ago, or if you have women in your life, daughters, nieces, friends going through this information is so important. We talk about actually it changes our bodies go through and things that we can do years and years and years after giving birth. And then we talk about what is important while pregnant so you can pass this information on to a loved one. So let me tell you a little bit about Lashonda. Dr. Lashonda Jones is an ortho-pelvic doctor of physical therapy, a certified personal trainer, a pre- and postnatal corrective exercise specialist with over 19 years of experience. She's the owner of Core Elevation Fitness and Wellness Incorporated, a global online company helping moms and women safely return to exercise, heal their diastasis, and restore their core and pelvic floors after birth or abdominal surgery. She's also the creator of the Cesarean Recovery and Safe Return to Exercise Guide and primary author on the 2025 Cesarean Delivery Rehab Protocol, tools that are raising the bar for postpartum care around the globe. I told you she is the real deal. This conversation, as I mentioned, so much to do with exercise, both while pregnant and after pregnancy. We talk a lot about C-section recovery. Lashonda is an expert in C-section and abdominal surgery recovery. So we talk about hysterectomy as well, and diastasis recti, such an important topic that I know I get asked about so often. You guys, this conversation is absolutely amazing. I could have talked to her for hours. Instead, we capped it for you so you can listen today on your walk, in the car, doing errands. Just promise me that you will listen, take notes, pass the information on to someone who might need it, because this truly will help women feel safe and feel supported in their bodies. So thank you so much for being here. And here is my conversation with Dr. Lashonda Jones. So thank you so much for being here on Meet Your Body. All of you listening, we have literally been trying to record for about a half hour. So if you hear us a little bit out of it, that's why, because we're physical therapists. We're not technology folks here, but,
Exactly.
but we have done our best. So thank you so much for being here on Meet Your Body today.
So happy to be here.
So tell everyone everything about your story you want us to know. Tell us who you are, where you are, everything.
Sure. So I'm Dr. Lashonda Jones, physical therapist, also personal trainer, corrective exercise specialist, pregnancy and postpartum corrective exercise specialist. I'm located here in North Carolina. I've been a physical therapist. This is my 19th year.
Wow.
Started out in orthopedics primarily. Just the world of backs and knees and shoulders and all of the things until I became a mom. And I was actually just at lunch with another PT telling her my story, how I came into this world of women's health. And she said, "So how did you do that?" I was like, "I became a mom. I
Yeah.
got pregnant."
You were
And then I
forced into
really
it.
learned what it was like to feel like your whole body and your world changed, and not have the support that you may have thought you would get, and just seeing how much of a lack of education and resources and support are provided to moms. And so that brought me into this wonderful world of pelvic health, women's health, pregnancy, postpartum. I'm a mom of two, of course. I have my daughter who's 7, my son who's 11, and I had a vaginal birth, long one with my son, and a C-section with my daughter. So that took me into the world of C-sections, diastasis recti, and that's pretty much what I specialize in. Owner of Core Elevation Fitness and Wellness. I've had my company since 2009. So kind of long time business owner on the side, going full time. And I absolutely love what I do, love working with moms, love working with women, supporting them, not just in the areas of just fitness and physical therapy, but also wellness and just having that support system. I feel like that's just so important because it can be a little chaotic, a little lonely, a little overwhelming, all the things out here. So yeah, I feel like I maybe said all the things, but that's kind of like me in a box of what I do and what I love and what I'm most passionate about.
That's amazing. And tell me this. So I first found you online. Um, I loved your messaging. And honestly, it is hard just to get really good information, like you said, about women's health, about C-section and diastasis specifically.
Yeah.
And I know myself, I had been a PT for 10, 15 years before I got pregnant and had my daughter, and I still did everything wrong.
Right.
A
Same.
prolapse, yeah, all the things. And I realized, oh my gosh, if I don't know this, how in the world does anyone else know this? So
Absolutely.
tell me, like, what surprised you most or caught you off guard during pregnancy, during the postpartum phase that really made you realize, oh gosh, we're just not taught this correctly?
Mhm. I think the part that was the most surprising to me, and I think I'll go back to like my first, because I think as a first time mom, everything is a little bit of a
Right.
shocker. But the biggest shocker for me, especially being in the medical field, is just how much help and doctor visits and all the things you get during pregnancy and then postpartum is like
Mhm.
crickets. That was like I honestly, there's a lot of shockers, but that was a big shocker to me just because I had a vaginal birth. You want to
Yeah.
have a vaginal birth, you want to have a natural birth, all of these things. But then I tore. So I had like a second degree tear. I had hemorrhoids. I mean, it was just a crap show, honestly, postpartum wise. It's not what I was expecting. So the amount of healing and recovery that I needed and I didn't get it. It was a shocker for me. I just felt really overwhelmed, alone. I had, the lactation consultant that was helpful, for that area. I had, my OBGYN to just kind of do a checkup with me. And then that was it. I was just like, well, now what do I do?
Yeah.
I was an ortho PT at the time. I wasn't pelvic. I didn't even know this stuff. And that was the sad part for me, is like, I did all this schooling. Why don't I know how to take care of my body? Why isn't nobody helping me with this? So that was
Mhm.
honestly my biggest shocker, and led me down this rabbit hole and career path into
Yeah.
pelvic health. I was like, and then I realized it wasn't just me. It was so many other women. I was like, oh wow,
Yeah.
you know.
When you started down that path, I am curious, how was that received by doctors, by the professionals around you? Were they open to sending you clients, or did they kind of say, oh, women don't need that? Women don't need that afterwards. No, we're good. How was that received?
That is such a long little journey. So luckily, I connected with some good OBGYNs. And I think being in the online space, the perception maybe is a little bit different, because then I was connecting with other OBGYNs that were also a little bit more open-minded, I would
Yeah.
say, in the online space versus in person. I also came across OBGYNs and other doctors where they were just like, no, my patients don't need that. But then, of course, as I work with my clients, especially globally in other areas where it's not so much perceived as needed, and it's still not even here in the US, unfortunately. So you would have women that were being, written off as, you don't need PT. So I had to advocate and educate a lot. Which kind of led me down that lane of education and
Yeah.
advocacy more than anything, just so moms and women understand that your voice should be heard. What you feel should not just be ignored. The symptoms that you're seeing or feeling, you deserve to get the care that you need. And so I found myself doing that more than anything, right? That was the education that I was providing. And so that's still the same to this day. Unfortunately, I feel like it's gotten better the more that social media, that's done the positive sides of social media, has really shown moms and women that, those things that you're feeling and seeing, there are solutions to those problems and those things. And it's not just, drink a glass of wine. It's not just, go back to your normal exercises. There's a whole side of rehab that is available to you that can be very helpful.
Yep. And actually, that's a perfect segue. So, for women who are going through this time,
Mhm.
and I guess I have two parts to this question. Is one is, what are some really common symptoms? Because one of my issues is that women go to the doctor and they hear, oh, that's normal, right?
Yeah.
I'm leaking urine. I have sciatic pain. I can barely lift the car seat. It's normal. You were
Yeah.
pregnant. It's
It's a
normal.
part of pregnancy. Yeah.
Yes, but also that doesn't mean it is okay, right? Like,
Exactly.
yes, it might be
Exactly.
common, but it's not something that's just normal to accept. So, can you talk
Exactly.
us through one, what are some really common symptoms that women will have, but also should be listening to and can have addressed in the immediacy? But then also, maybe, what about women 10 years later still experiencing issues, 15 years later? What are their options?
Mhm. And so symptoms that we're talking about, are we talking about specifically just postpartum in general, or just
Yeah, let's start
PCOS?
postpartum and then, yes, we should get into pregnancy too.
Oh my God. Well, I feel like there's so many symptoms that
Yeah.
moms can be experiencing postpartum. Like you said, a couple of them, sciatica, pelvic pain, and a lot of things will be surprising, where I didn't have this during pregnancy. Now, all of a sudden, have
Mhm.
these symptoms postpartum. And so that ligament laxity, your organs have shifted. Swelling is now a part of the picture in a different way in postpartum than it was in pregnancy. And so you can have all sorts of both orthopedic and pelvic floor type issues coming up. So prolapse, leaking, back pain, pelvic pain, glute pain,
Mhm.
tailbone pain, from the baby. I mean, just so many different symptoms, but pretty much no matter what the symptoms are, majority of those things can be addressed with physical therapy. The majority of those orthopedic or those musculoskeletal pains that you may be having can be addressed with PT. And so that's the main thing that I want moms to know, is that, even though you're having those symptoms, whether they're acute, now some things may kind of work themselves out over the first week as the symptoms go down, as the swelling goes down, things like that. But if it's lingering on, and if something's just not right, a lot of PTs are direct access. And I love for moms to know that, because people say, I
Mhm.
don't know if my OBGYN or my doctor will even give me a referral. Well, you can just go. You can just go
Yes.
to a PT, right? You can advocate for yourself. And so just knowing that can be very empowering. Just go see a PT, have an assessment done, and see how we can help you. And then for moms who have these symptoms chronically, because a lot of moms are just now getting on social media and hearing
Yeah.
about these things, they're just like, well, what can I do? My baby, quote unquote, is 20 years old. What about the leaking that I'm still experiencing?
Mhm.
Again, those things can still be improved even many years down the road, whether that's diastasis recti, prolapse, leaking. Most of those symptoms can be improved even years down the road. And so that's the good news about those things. And even though it's been around, and it may be a different route that we would take if you were more acute versus chronic, but still, there's definitely ways to make improvements in those things.
Yep. And I love, because I know you talk about advocacy and accessibility. And so, everyone listening, direct access means that you can see a physical therapist without a prescription. And many times that's still covered. So, we're not
Mhm.
even talking, I mean, cash pay is an option,
Right.
but many times the state legally allows you to see a physical therapist without having a prescription from your OBGYN. So, if you are in that space where they are not promoting it, but you still want it, talk to your insurance company, and it is a legal access that many states have.
Yeah. Yeah.
Yep.
And that's so empowering, because
Yes.
unfortunately not every doctor will see that there's a need there,
Yeah.
right? And so they may not feel like you'll need that, and therefore they may not refer you. But like you said, there's other options and ways to go about it.
Yep. And you said you offer virtual work
Mhm.
and consults as well.
That's correct. That's correct. And so I work with moms mainly, in the wellness space, but
Yeah.
I offer diastasis, recti, C-section consultation. So I'll do scar massage with moms, even through virtual, because again, a lot has happened, in those first 6 weeks. A lot of times moms are not even able to get the car seat and the baby and all the things, right? We're telling you don't lift over 6 or 7 pounds, and you got the baby, the car seat, and all the things. And so virtual is such a wonderful way to access that care. We can go over pain reduction, swelling reduction, getting in and out of the beds, how to get up and down stairs. Like, there's so many things that we can do in just those first few weeks. And so a lot of people think, oh, I have to wait till after 6 weeks. Now, there's so many things that you can do exercise wise. And when we say exercise, meaning regaining mobility, posture, swelling, all sorts of things that we can do to make that recovery so much faster, easier, for moms. And so I do a lot of that, a lot of those things online as well. And so just knowing that those things are there is just so empowering for moms, so that they feel like I don't have to just wait forever to do things. And there's, protocols and things that we've worked on to help other PTs to be able to know when it's the safe time to do those things and things like that as well.
Yeah. Oh, that's so amazing. And these are things that really weren't available
Yeah,
20, 25 years ago.
absolutely.
Um, and I feel like, just to throw it out there, women, this is a time that you absolutely should be taking care of yourself. I think there's another kind of thought out there, in addition to oh, it's just normal, is, oh, now you have someone else to take care of.
Hmm.
Just be grateful, right? Just be grateful that you're a mom, grateful that you have a healthy baby, which absolutely, yes. And also, you are allowed and absolutely should take care of yourself during this time, whatever that means to you. Have you found that that's something you kind of have to work with in that wellness space, as well as kind of working with moms? Just, hey, let's find some time for yourself right now.
Oh, 100%,
Oh,
100%. And I feel like there's just, everything's so focused on the baby, right? Pregnancy, the baby, checking for the baby. And so it's almost ingrained in us in
mm,
going into motherhood, like everything's about the baby. And so it almost feels wrong to take care of ourselves. But I mean, I'm a big advocate, you can't pour out of the empty cup. I feel like that message it just hits, right? Because it's so true. It's like it's very difficult to be able to play with your baby, and that's what a lot of moms who come to me, like things for diastasis recti and so many other issues, like I can't even lift and play with my kids, and so
mm,
that's taking time away from your kids, ignoring the pain, just pushing it off, things like that. And so you have to think about it from a proactive standpoint of, in order to be able to be the best mom and have the energy and be able to do the things without worrying about leaking and pain stopping
Yeah.
you, taking that time to take care of yourself is been helping you and your baby and your kids and your family. And so I think that sometimes that perspective really helps moms see, like, you know what, I am worthy of it. Even outside of those things, just myself, I'm worthy to feel good in my own body. And it's totally worth investing in my health and myself as well.
No, that's perfectly said. So let's go. You've talked about diastasis recti a few times. Let's jump into that because I know it's one of your specialties, absolutely. And I get this question, I mean, all the time, right after birth, but really, I mean, women 30, 40 years after birth. So let's dive into it. Tell us first what it is. Like, explain to us anatomically what is happening.
Right. And so I feel like, number one, I'm so grateful for the amount of information that has, improved about that, but there's still so much confusion about diastasis recti as well. So essentially, anatomically, the six pack abs, you have your two rectus abdominis muscles. So those muscles begin to separate the actual linea alba, tissue thins, like all of those things, like a natural part of pregnancy in order to make room for baby, the organs enlarge, all of those things. And so a lot of moms have a lot of fear around diastasis recti, feeling like it's not something that I want. How do I prevent this? How do I get rid of it? That type of thing. But I like to educate moms again about their bodies, is that this is a natural part of pregnancy. This abdominal separation is just happening so that those muscles are not basically being actually torn, because I used to hear that term so much. Your abdominals are torn. They're not actually torn. Those tissues are just thinning, they're widening, they're just making room for the baby. And so once the baby is here, unless you have the proper rehab, corrective exercises, and things like that, and yes, there's some degree that will come back together naturally after the baby's born, but unless you have those corrective exercises to help those muscles regain back the strength, those thin tissues again to thicken back up, then the diastasis recti, which again, it means like me having maybe over 2 fingers worth or 2.5 centimeters bigger than those 3 fingers of a gap in between those two abdominals. That's where you have an actual diastasis recti. And so if you can fit those 2 to 3 fingers between your abdominals, you have a diastasis recti. And again, that's something very common, but there's so much that can be done to help it.
Yep. So tell me, because this is the way I've kind of always thought of it, and so tell me if this is correct, that it sounds like every woman goes through this during pregnancy, right? I mean, there's no way to prevent your abdominal muscles from separating during pregnancy. As you said, it's kind of a natural part as the baby grows. And then the issue is more afterwards if they come back or not. Is that correct? And feel
That's
free to
pretty
correct
much
me if I'm wrong. Okay.
basically. So the research basically says that, over 90%, I've seen different numbers out there in reference to the diastasis recti, but that's why I like to use the term diastasis recti in postpartum, abdominal separation in pregnancy. That's the way that I personally like to do
Yeah.
it, just because that
Okay.
abdominal separation, the degrees, it's just going to different with pregnancy, how you carry, so many different things that can make that determination in
Right.
pregnancy.
Okay.
Postpartum, the actual diastasis recti, the diagnosis that most people know, having diastasis recti surgery, all of those things, because you're not going to have diastasis recti surgery pregnant,
Yeah.
right? You know what I mean? And so that's why I just kind of separate the two things and say those abdominals are going to separate in pregnancy, but postpartum, diastasis recti, again, if you still have it after 6 weeks, 8 weeks, once that uterus has kind of gone back to its normal size, and you see that you're having other symptoms in addition to it, the core weakness, all of the, other additional things that you may have, then rehab will be very appropriate for you.
Okay.
Yeah.
And in addition, is there anything else women should be looking for? I mean, in addition to the separation, as you said, which I want you all to hear, 2 fingers width is we don't diagnose it yet. Like, it's not a diagnosed diastasis with 2 fingers. And I think a lot of people, and I know we could do a whole podcast on pre-baby body, which I'm doing that in air quotes, anyone who can't see, um, because you don't go back to
There's no
your
pre-baby.
pre-baby body. I
Never.
mean,
Yeah.
and that's okay. I mean, I don't want to go back to my pre-baby life. I like my post-baby life. I
Yes.
like my baby here, and but our bodies are different. But just know you can still find your strength. You can be stronger than ever even if you have a separation of one finger width.
Absolutely.
So in addition to kind of that general diagnosis that everyone knows, are there any other kind of symptoms or things women should be looking for that might indicate they do have that DR diagnosis postpartum?
All right. So from a physical standpoint, the most common that moms will see is just that coning, doming right there in the midline. So say that you sit up, the baby's crying, and you're like, it just looks like, a lot of moms used to say, it looks like an alien in my baby. I don't hear that term so much, but I remember I used to hear that a whole lot. But basically, it looks like a tinting, a doming right in the midline of your tummy.
Okay.
Pain is not a general symptom that you have as a direct result of the diastasis recti, but it can be a secondary symptom that you have. So back pain, a lot of women that have diastasis recti also complain of back pain. And so a
Okay.
lot of times you may see, oh, the diastasis recti caused my back pain. It's not really a cause and effect, at least what research says, from a clinical standpoint, we see otherwise, but that is a very common symptom, again, because that core system is weakened. Those tissues are stretched, those muscles are weak. So therefore, there's compensatory postures and compensatory muscles that are being used because of that weakened core. And so those symptoms may also be present as well. But mainly the coning, that I feel like that one is like the kind of giveaway sign that not only do you have diastasis recti, but also you're not managing that pressure well, that's causing that coning at the midline where those tissues are, which basically we want to teach you how to manage the pressure better, with exercise, with lifting your kids, with exercise and activities and things like that. And so there's still so much you can do, but those are the main things that you will probably see or feel, along with the diastasis recti.
And do you find that there's any situation that women can kind of manage this on their own, or do you find physical therapy is kind of 100% recommended in women with the separation?
Mhm. Yeah, again, very diastasis recti can look completely different
Okay.
person to person. Some people may not ever really need formal physical therapy specifically for the diastasis recti. For example, for myself, so my son with my first, I had diastasis recti. It was very minimal. I didn't do any form of formal rehab per se, outside of what I knew then, again, being an ortho
Yeah.
PT. And I was basically quote unquote fine. And I say quote unquote quote because a lot of times we get so hyper focused on the belly, and we
Yeah.
don't realize there's so many other things that happen to our bodies outside of that. And so I feel like
Mhm.
that's the mistake that a lot of moms make, is that, and this is because of society, right? We want to snatch back. We want to look our bellies to look like it did before baby, and so we get so hyper focused on the belly, not realizing that, oh, there's so many other things that kind of happen to my body. Even though I've gone back to exercise, something's not quite still right. And so I do advocate for moms to at least be assessed by a
Mhm.
pelvic PT, because there may be other things that kind of come into play down the road. You're just compensating, you don't know why. And then all of a sudden, I'm leaking. I wasn't leaking when I had the baby. 3 months later, now I am when I go back to try running again and things like that. And so
Mhm.
there's so many systems that are impacted in postpartum. And so I do recommend being assessed by a PT, because some people will say, well, my OBGYN said that I didn't have diastasis recti, and they'll have like a 4 or 5 finger separation. And so it's just best to be assessed by someone that's their specialty, so that they can assess you, teach you mechanics, teach you exercises that you may have never learned in your life. I knew nothing about diaphragmatic breathing, nothing
Yeah.
about the transverse abdominis muscle like that. I never knew those important things. And so again, I
Mhm.
say I went back, but I wasn't doing what I would do now, something completely different, in reference to my exercises and things that I would have done, even though the separation wasn't there. There's things I could have done better that would help me down the road.
Yes. Oh, it's perfectly said. And then you also add on the considerations of not even discussing being pregnant, but you're now carrying a baby, possibly 20 hours a day, or wearing a baby. You're right. You're lifting car seats. The heaviest. I did not know. I did not understand how heavy a
Those
car
pieces.
seat is with a baby, is it? Like, and when I'm putting it in a car, I've never sweat so much in my life as when I was doing
Absolutely.
that. And so there are so many considerations of just how your life changes
Oh,
if you're
absolutely.
wearing the baby, if you're nursing, all of those things.
Yep.
Um, Talk to us a little bit about C-sections
Mhm.
and what that might look like post, how it's the same, how it's different, just considerations women may need to take into account if they do have a C-section.
Yeah. So, so many, I wish we had so much more time, so many
I
different
know.
considerations because I thank God, for both of my babies and
Yeah.
even both of my births, even though it was, the rehabs were totally different for me.
Mhm.
It was so eye opening in reference to the differences between the two, the recoveries between the two. And so with the C-section, the difference, especially let's kind of tie it in with the diastasis recti. So when we talked about the two abdominals being separated, the tissue being thinned, um, that's with the vaginal birth. With a C-section, that tissue is actually cut. The linea
Mm.
alba is. And so that is a difference in itself. And so not only is the linea alba tissue cut, the skin, fat, fascial layers, your
Mm.
uterus. And so now we're talking about organs being involved in a different way. Instead of your uterus just being shrinking and, going back to
Yeah.
size and enlarging, it's actually cut in a C-section.
Mm.
So the rehabilitation is just so different because you've had an actual surgery on top of giving birth to a human being. And so that is just different in itself. And so, yes, there's more swelling, there's different pain. Now there's nerve pain involved, which pain can be involved vaginally as well. But again, it's from the surgery with C-section. And so your recovery is different in reference to a binder, needing to wear a binder. Your posture is impacted differently because you want to be hunched over because of your incisions and things like that. It's just a
Yeah.
higher risk for returning back for infections because of the actual incision. Like it's just so many different things to have um, to be considered, and also from a mother standpoint to worry about when you take a baby home. And so I do a lot of education and want moms to be educated about the importance of wearing the abdominal binder, not a waist trainer or anything to snatch back, but to help with reducing the swelling, to try to help with improving how your C-section scar heals and things like that. And then from a diastasis standpoint, yes, those muscles, yes, those muscles were preserved in the sense they don't cut the muscles, but they did cut the linea alba tissue. And so again, making sure your core is protected, learning how to do log rolling and mobility and things like that when you're getting up and out of the bed, something you may not have to consider so much when it's a vaginal birth. And so again, I feel like having a PT as early as possible, as soon as possible, to teach you those things can be very vital in your recovery time, and being able to reduce risk of other issues down the road as well.
Yeah.
Yeah,
And I think, I mean, tell me if this is still correct, that C-section is the number one most common surgery for women in the United States.
yeah, that is correct.
And I just want to point out, I don't think there's another surgery for any human being that is really, oh, you had surgery, go home, do whatever. I mean, yeah, there's no
Yeah,
specific
especially
training,
when
no
there's not a
support.
whole other human being involved in it.
Right,
Like you
right,
actually gave birth and
right.
then you are sent home, and I literally, the words were actually told to me. I won't say any names, but OBGYN told me this recently when I was working on a cesarean rehab protocol, myself and a few other PTs and OBGYN. We got together and we created a rehab protocol, a
Okay.
cesarean rehab protocol to help other PTs bring rehab into their hospitals, be able to help C-section moms earlier
Wow.
in the hospital, in the homes, because right now C-section moms, you have a cesarean, you stay in the hospital those few days, make sure you're healing well, you can get up, you can take a poop, you can pass gas, and then you go home. And so like I already mentioned, getting up and downstairs, getting in and out of the bed, moms are figuring those things out by themselves and they shouldn't have to.
Right.
And so we're wanting to get PTs in there in the hospitals. And if moms are listening to this, see if your hospital offers that, because more hospitals are, a lot don't, unfortunately. But advocate for yourself and see if you can get a PT, especially if you're having any type of birth complications. Get a PT into home health, come to your home, have a virtual visit with myself or a PT that offers virtual visits, so that you can understand how to get in and out of the bed safely, how to take care of your soil, how to reduce the swelling so that you can get better.
Yes.
Yeah.
And it's so hard. Birth is amazing and birth is hard no matter what, right? Like no matter what your birth story
Yes,
is.
right.
And so it can be hard on the back end, I think, sometimes to be thrust into it. And so
Yeah.
having all of these things kind of ready, like let's say you are pregnant or you're thinking about getting pregnant or you have
Yeah.
a daughter who's pregnant and you want to prepare them.
Yeah.
What are some things maybe on that front end, if there's a few tools that they can do, or
Mhm.
even ways to be a little more prepared once that baby comes?
For sure. And so I tell moms, if you're expecting, period, just have a few items there, because my C-section was an unplanned C-section. And
Mm,
honestly, that's a lot of moms' case. There are the planned C-sections where you have a time to prepare your home, prepare, the fact that you're going to be out of work maybe a little bit longer, things like that. But a lot of moms is either unplanned C-section or an emergency,
okay.
because things just didn't go as planned or things like that. So having things like a binder, cheap,
Mhm,
right? You can have just a cheap binder
mhm,
available. Having things like a co-sleeper, I think, is really helpful. Something so simple as that, right? Having a co-sleeper so that you can just roll over, have the baby close to you so you're not straining at your core, things
mm,
like that. And I actually have a whole entire list of C-section recovery must-haves. It's a freebie. I'll make sure I give Jessica the link. It's a free download. You can download all of these things that I'm basically saying. But compression socks, just to help with the swelling, reducing DVTs and things like that. I don't like moms that have to be overloaded with a lot of things, but those are like some of the main essential things where, okay, even if you have a vaginal birth, you're not going to go down in the pocket in regards to that. But there's a whole list of other things like silicone scar sheets, things like that. But of course, if you don't need those type of things, you won't really
mhm,
use them. But there's things that can help with the C-section scar healing, and that you can use within the first few weeks. But the main things that you do in those first few weeks with C-sections is just reducing the swelling. So ice packs, things like that, the binder wear, getting up and moving, and then just learning simple mobility exercises, diaphragmatic breathing, things like that. And those are all things that you can do, don't cost you anything, but can
yeah.
help with your recovery so much.
Okay. And would you, because I'm thinking right now, like one thing I tell my clients is if you are going to schedule a consult, anything like that, do it before you give birth. Because in
Yeah,
those first few weeks, you are just in a
you're not
fog. You
thinking
don't
about
even,
stuff like
right. And so is there kind of a timing that women can think, okay, 2 weeks after, 4 weeks after, what's a good time that they might want to see that PT virtually or in person for the first time after birth?
2 to 4 weeks is a great time period, honestly. Give yourself those first 2 weeks to just rest,
Yeah.
recover, let your body heal. But after that, within those 2 to 4 weeks, if you can get in with the physical therapist, and when you go in, and some people, because they don't know what to expect, just understanding that it's really just helping you learn how to reduce the swelling, and all of these things are going to help with the pain. So when you're
Yeah.
already in pain, the last thing you want to think about is a physical therapist, somebody touching me, somebody probing me, and it's not like that, right?
Yeah.
The whole goal there is to reduce that pain, reduce that swelling, so that you can start to actually wear regular underwear and things like that, and so that you don't feel the pain from the incision, you don't feel the swelling starting, the pain from the incision with the underwear and things like that. So just again, having that physical therapy to help you with those things is going to help with the recovery so much
Okay.
better.
Okay. And I mean, I truly could. We could go another hour. I know that you need to go pick up your daughter. Tell us, speaking of, this is what, now we're 10
We
years
don't, we
later,
don't got
right?
no time. We got about maybe 10 more minutes. If you have another
Oh,
question,
great.
yeah. So 10 more
Okay.
minutes.
Yes.
Yeah.
Yes. I would love to know then, because I know people are going to ask about exercise, and there's so many different
Yeah.
nuances to this, again, depending on C-section or not, or what your fitness was before.
Sure.
What are your kind of general guidelines for exercise and fitness after giving birth?
Yeah. So, C-section versus vaginal, it will differ a little bit, but for the most part, it's about the same, especially those first few weeks. So getting up, mobility is going to be really, really key. Mobility, diaphragmatic breathing, just reconnecting with those muscles. Because that, you asked me in the very beginning, what was a surprise for you?
Yeah.
Feeling like my body was mush.
Yeah.
I was just like, I feel like Bambi. Like, I feel
Mhm.
like I have new sea legs under me. What is happening to my body? Like, I remember that feeling very distinctly. And also remember trying to do like lunges and felt like my pelvis was gonna like separate.
Oh,
Like
yeah.
that was a shocker for me. So going
Mhm.
back to that question, so
Yep.
that's where I tell moms, don't try to jump back into exercise as normal.
Mhm.
Reset your core. Reset
Yeah.
your foundation with things like learning how to do diaphragmatic breathing, restoring mobility and things that were so tight. So your body changes, your posture changes, how our bodies were carrying the baby. And so just getting that mobility back in those pelvic floor muscles, in those back muscles and your core muscles, that can be so, so helpful in those
Mhm.
beginning stages. Doing simple postural strengthening exercises, because you're going to be a lot of forward holding, forward lifting, things like that. You're going to feel really tired in your upper body. And so just doing basic strengthening exercises. And when I say basic strengthening exercises, I'm talking about simple bands, things like that. You're
Yeah.
not lifting 20 pounds, nothing too heavy, too crazy. But again, just getting those muscles to work like they're
Mhm.
supposed to work. Those are the type of things that I generally like to stick with those first few weeks,
Yep.
just to feel more connected. The glutes are really
Yeah.
important in that picture. Simple bridges, glute sets, things like that. And then let me see, from a C-section standpoint, again, pretty much most of those things, same
Yeah.
things, some things a little bit different. But again, getting mobility, posture, breathing, just those simple foundational exercises in there in those first few weeks.
Yeah. And I think for everyone listening, what we probably want you to hear is that idea that you don't do anything for
Mm-hmm.
6 weeks and then suddenly you're allowed to do whatever you want. That does not make any sense. We
No.
don't do that for any other injury. I mean, ankle sprains, shoulder pain. There is no other injury that we say do nothing and then do whatever you want.
Yeah.
There is a buildup. You have to retrain your body. And so I love that you're saying you don't have to wait 6 weeks to do that. I mean, there's so many pieces, but it needs to be done in order to keep your body
100%.
safe and
Absolutely.
then feel your best. I mean, I think if you wait 6 weeks and then you try to jump back into your pre-activity, that's where kind of that resentment can happen, right? That
Correct.
you're like, oh, this isn't the body I had before. Well,
Oh,
no,
yeah.
you have to work for it.
Oh,
You
yeah.
got to get there.
Absolutely. And you'll be surprised at the difference. There's such simple exercises that people feel like I'm doing nothing, but you're
Right.
doing so much because, again, you don't go into the gym and just lifting 20-pound weights when you haven't worked out in a year, right? You start small, you
Yeah.
work your way up, and you progressively get those muscles stronger, and you progressively include more weight and things like that. And so those basic foundational exercises, number one, it feels good. Just breathing. We need to breathe as mothers. We need those 5 minutes to just breathe. And so just doing those simple exercises, you'll start to feel that back pain start to let up. You'll start to feel reconnected with those core and pelvic floor muscles. And so everything's not Kegel, Kegel, Kegel. It's really just connecting to the muscles again and learning what those exercises look like, doing them correctly, and just feeling empowered that, you know what, I'm doing what I need to do to feel stronger, feel better, move better, and then you can get back to the exercises that you may be used to, right? And so that's what you want to do, is continue to do those type of
Yeah.
exercises and build on top of there.
Is there anything long term, like let's say long term considerations? And I think I probably know your answer, but I want to put it out there. Is there anything that women can't do, again, long term, after giving birth?
No. Is there anything
Great.
they can't do? Like, is there a
Yeah.
specific exercise they can't do? No.
Hmm.
No, and that's why I saw some of the list of questions, and I wanted to make sure that we hit on that. Is that so many women are made to feel that exercise is a scary thing, even in pregnancy, right? Don't do this, don't do planks, don't do sit-ups. You can never run again. You shouldn't do this. And there's always an an extenuating circumstance out there to where like maybe that's not the best exercise for you and your body because of your medical history and things like that. So I wouldn't say that everybody's going to go back running again, right? That's not the point. But there's no one set of exercises or things that you can't do. It's all about learning how to do them safely. Your body has changed, right? You're not going to have the pre-baby body anymore. So things have stretched, things have changed, and so you may do different exercises than you used to do before, but that doesn't mean all of a sudden you're weak. In fact, you can be even stronger post-baby if you learn about your deep core. I never knew about my deep core like that until I had my babies. That's where those terms deep core kind of came into the picture. And I'm like, I should have learned about this before I had my baby, you know? And so you want to be doing those deep core exercises pre-baby, during baby, post-baby, because that's what's going to keep you strong, vibrant, being able to go on hikes and go back to swimming and go back to running and Pilates and yoga and whatever you want to do. All of those exercises are back, are available to you, but you just want to do it in the right progression and you want to do it safely and smartly. So did I answer that question correctly?
Yes,
Is that
100%. Well, yes, you can answer it however you want.
Well,
I
I just
should
want to make sure
let
that's
the
what you're
witness.
basically asking me, right?
Yes.
Okay.
Yes.
Let
Yes,
me make
because
sure.
that's
Yeah.
exactly what I think that it's just put out there that women in so many ways, right? That we just suddenly change after we give birth. Everything's different. I want to get back to the way I was before, but I'm not allowed. And it's like, just this idea of reframing, you can absolutely, like you said, there's always considerations. But exercise, movement, your body is still available to you. It is still yours. And look at what it has done. I mean, I came out grade 4 prolapse in all ways kind of broken. And yet I felt more empowered, stronger than I ever had in my life. I birthed a human baby. So if you take that kind of commitment, if you just take that mindset into intentionally taking the right steps to feel strong in your body again, you'll get there. You absolutely will get there.
Absolutely.
Yeah. Thank you. You're so amazing. I love this. Tell everybody where they can find you. I know you said you're going to send us that link. I'm so thankful, but tell us, the website, social media, tell us everything.
Absolutely. So my website is coreelevationfitness.com. That's where you can find pretty much most things that I offer, from one-on-one consultations with me. I have a Fit Mama membership as well. So that's where I offer all of my programs: diastasis recti, C-section, post-abdominal surgery. So not just C-section, but also for post-tummy tuck, myomectomy, hysterectomy, all of those things. So if you had any type of abdominal surgery, and you want to feel better, you want to get back to recovery and get back to lifting, CrossFit, whatever it is, I have programs for that as well as free resources. So I have like the diastasis recti healing guide. I have C-section recovery must-have list. So check the website out for any of those type of resources. And you can also find me on social media at PT Trainer Shonda as well. On Instagram primarily, I try to limit my social media as much as possible. I'm probably on the other platforms as well, but you will find me mostly on there on Instagram. And yeah, that's pretty much me in a nutshell. Absolutely so thrilled to be here. And if I can be of any resource or help, I'm happy to do so.
Thanks so much for listening today. I would love it if you could take a moment to subscribe, rate, and review this podcast. It means a lot to us and it helps our content get out to more women who need it. You can find more of my resources at my website, jessicavallant.com, or find me on YouTube at Jessica Vallant and Instagram at Jessica S. Vallant.
The holidays mean more travel, more shopping, more time online, and more personal info in more places that could expose you more to identity theft. But LifeLock monitors millions of data points per second. If your identity is stolen, our US-based restoration specialists will fix it, guaranteed, or your money back. Don't face drained accounts, fraudulent loans, or financial losses alone. Get more holiday fun and less holiday worry with LifeLock. Save up to 40% your first year. Visit LifeLock.com/podcast. Terms apply.